Let's go over to some basic anatomical terminology that will help us understand different landmarks and directional references in regards to the human body that will make it easier to understand a variety of parts and things and why they're named the way that they are. Let's jump in, starting with some directional terms. So it's starting with superior, meaning towards the top of the body, and inferior means toward the bottom of the body or towards the feet. Next up is medial, meaning it's going to be towards the midline, and lateral refers to away from the midline of the body. Now we have a side profile, anterior, meaning towards the front, posterior towards the back, or we could use the terms ventral towards the front and dorsal towards the back. Now, why do we have two names for this? Because of the rest of the animal kingdom is oriented differently. So their anterior is towards the nose, posterior towards the tail, ventral towards the chest, and dorsal towards the back. Hence the famous name for the dorsal fin there on our shark. Next term is going to be proximal, meaning it's towards the torso, and distal is further from the torso. And then our last directional term is going to be superficial, meaning towards the surface of the skin, and deep, meaning toward the interior of the body. Now let's go through a variety of planes. The first one's going to be the transverse plane. That's going to create a top and a bottom. Our next plane is the sagittal plane, creating a left and a right. And our final plane is going to be the coronal or frontal plane, and that is going to make a front side and a back side. Now, a ton of terms here. Looking at our torso, axilla, meaning armpit. Brachial, meaning arm. Antebrachial, meaning forearm. Thoracic, referring to the chest. Mammary, referring to the breast. Abdominal, toward the stomach. Umbilical, the belly button. And pelvis, referring to the pelvic region below the abdomen. Flipping over to the back side, we have acromial, referring to the shoulder, dorsal towards the upper back, popliteal behind the knee, lumbar, lower back, olecranial, the backside of the elbow, and gluteal for the butt. Now if we zoom in and look at just the hand, we're going to refer to this as the manual region. Palmar, meaning palm. Digital, meaning fingers. Carpal, meaning wrist. And pollex, meaning thumb. Let's look at the lower extremities now. We're going to start off with inguinal, meaning groin. Pubis for the pubic region. Femoral for the thigh or the upper leg. Patellar, referring to the kneecap. Crural for the lower leg. And then let's take a look at the foot itself. Foot is going to be referred to as the pedal region. Tarsal, referring to the ankle. Calcaneus, referring to the heel. Plantar, referring to the sole of the foot. Hallux, referring to the great toe. And then digital, once again, referring to the phalanges or for the toes. And then our last slide here towards the head and neck. Cephalic for the head region. Frontal, meaning forehead. Nasal for the nose. Oral, referring to the mouth. Otic, referring to the ears. Ocular, orbital, referring to the eyes. Buccal, the cheek. Mental, the chin. Cervical, the neck. And then cranial for the top of the head. That is a variety of anatomical terms and terminology that will help us better navigate the human body.